Hello, my name is Zovko and I'm a community pharmacist. This episode will provide some insight on a pharmacist supporting patients to self-manage reflux disease. During this episode, I'm going to give a brief overview of reflux disease, explain the evolution and potential complication of reflux disease, and how pharmacists may identify and assess reflux symptoms and decide on appropriate course of action. Identify strategies that pharmacies may employ to empower patient self-care education. So let's start. Gastroesophageal reflux disease, or GERD, has been defined as effortless movement of the stomach content into the esophagus or mouth, causing troublesome symptoms or complication. Lower esophageal sphincter, together with the muscles and ligamentum structures of the diaphragm, makes anti-reflux barrier between esophagus and the stomach. So the crucial factor in GERD is increased amount of gastric content refluxing into the esophagus above the physiological level. This creates pathological exposure of the esophageal mucosa to the gastric acidic content, which may lead to the symptoms and also to damage. The underlying pathophysiological mechanism may involve anatomical components such as the LES and the diaphragm, but also functional components such as the LES incompetence, transient LES relaxation, impaired esophageal muscular coordination, gastroduodenal dysfunction, and other alternations. So this animation in the video illustrates the process of the gastroesophageal reflux disease. So here we can see in the best way what happens inside the organism. The predominant complications include dysphagia, for example, difficulty in swallowing, also bleeding from erosive esophagitis. This happens due to inflammation or irritation of the lining of the esophagus. Esophageal adenocarcinoma, and also the vast majority of patients with complicated GERD have a hiatal hernia. Most patients with the GERD present with heartburn and effortless regurgitations. Less common symptoms include dysphagia or difficulty in swallowing, also odynophagia, which means painful swallowing, chest pain, water breath, or mixture of a spit and stomach acid that can cause an unpleasant sour taste in the mouth, burping, hiccups, nausea, and also vomiting. However, pharmacists must also pay attention to extraesophageal symptoms in these patients, especially when the more common esophageal manifestations are also present. Such symptoms include chronic throat clearing, cough, enamel erosion, otitis, throat pain, sinusitis, voice hoarseness or dysphonia, asthma, and postnasal drip. So the goals of the treatments are to provide symptoms relief, to heal esophagitis, to prevent long-term complication. Therapeutic measures are directed at reducing the reflux and its consequences, protecting the mucosa, reducing the mucosal sensitivity, and also improving healing. Treatments need to be individualized, dependent upon clinical profile, disease severity, dominant pathophysiological mechanism, cost, availability, and also individual preferences. Supporting education of our patient is intended to improve patients' disease, enabling them to manage disease, eventually improving quality of life and also reducing healthcare costs. Some of the measures that pharmacies can recommend include behavioral interventions. Patients have greatly improved in feeling in control, understanding their symptoms, and knowing about the reflux. Empowering patients to understand relevant anatomy and physiology, learn behavioral techniques to change eating patterns and manage stress, identify actual and potential triggers is beneficial. Weight loss and also tobacco smoking cessation should be recommended to GERD patients who are obese and also smoke, as these are significant risk factors. Eating smaller meal, avoiding food that trigger symptoms, and steering clear of high-fat food is important. Avoiding eating shortly before going to bed and elevating the head of the bed is also effective to prevent nocturnal GERD. So other strategies also include reducing anxiety. Due to discomfort and the pain associated with this condition, patients with reflux may experience anxiety because the fear of experiencing these symptoms. Encouraging patients to communicate effectively, try to introduce them with eating techniques to reduce aspiration, which can be very helpful to them. Where it's possible, also use infographics to answer patients' questions. Introduce patients to available health technologies or support groups that can also provide support and in self-care, for example, for weight management. So in addition, pharmacists can also recommend a range of pharmaceutical treatment options, but that will be described in another episode of this series. So, in a summary, reflux disease is an extremely prevalent condition caused by effortless movement of stomach contents into the esophagus or mouth, causing troublesome symptoms or complication, namely related to the effect of gastric acid on the mucosa. So the most common symptoms include difficulty or pain in swallowing, chest pain or sore throat in the mouth, burping, hiccups, nausea, and vomiting. The course of the action is dependent on the severity and duration of the symptoms. Self-care tips that promote behavioral modification have been proven to be very beneficial in disease prevention, but also progression. So check the rest of the series to learn about treatment options for managing reflux-like symptoms.